The use of masks has been something that everybody has been interested in. And as you know, initially WHO felt, and the guidance of WHO was that masks, particularly medical masks or surgical masks, were only needed to treat patients, for people who deal with patients and for patients themselves, so people infected with COVID. Recently, the guidance by WHO has changed, and WHO now recommends that if there is widespread transmission of the virus and there are places where it's difficult for people to keep a distance, to wear cloth masks. Masks, so not the disposable ones, but the cloth masks, mainly to protect other people. Because, why did the advice change by WHO? It changed because there were studies that came out that started saying, well, actually, masks in those situations can help. And so for that reason, WHO changed its advice, because the science was saying masks can help. And that is actually very typical for the situation we are currently in. COVID-19, coronavirus, is a new disease. There is a lot of science that is happening to better understand what is going on. And WHO bases its advice always on the latest science. So if the science changes, then WHO's advice will also change. So in terms of the masks, WHO is now advising to wear masks also when there are many people around. So not just when there are sick people around, but also when there are just many people around. And I think for Nepal, it may not change all that much actually, because in a way, many people in Nepal were already wearing masks even before that advice came out. Maybe partially because people in Nepal, particularly in Kathmandu, are used to wearing masks because of the pollution. But also I think just in people's minds, because this is a respiratory disease, people may think that it is transmitted through droplets, which is correct. Why not wear a mask? It's probably providing some kind of protection. And in this case, indeed, the science is now saying that wearing a mask may be helpful. And therefore, I would certainly recommend that people, when they go out, particularly when they are in more crowded areas, to wear a mask to prevent infection, and particularly to prevent infecting others.